you some health headlines now. This month is Stress and Alcohol Awareness Month, and the two can go hand in hand.
They can. Dr. Pearl Kumapali with Deaconess Health System joins us now with tips on managing stress and how Deaconess can help. So good morning, Dr. Pearl.
Good morning. How are you guys?
Great. Thank you.
I feel like it's always a stressful time, but usually, you know, when the seasons change and it's the spring and people are really busy, this can be very stressful for folks.
Yes, so stress, you know, there's some good stress and, you know, not so good stress. Right. So we need some good stress to kind of, you know, build us up. For instance, working out, you know, you stress out your muscle and it builds and gets stronger. However, some chronic toxic stress is actually not great for us. And some of the tips that we talked about in terms of stress is chronic lack of sleep causes a biochemical reaction that is constantly releasing some cortisol, which is a stress hormone. So some tips is really to really improve our sleep, to make sure that we're getting off our phones or we're putting off our phones at night, developing some good sleep hygiene habits, deep breathing in moments of, you know, stressful situations. Deep breathing, stepping away from some stressful situations can help so that we're managing the acute stress that builds up to become chronic stress.
And of course, I mean, you're Dr. Pearl, I'm sure someone like you can also offer advice and help as well during this.
Absolutely. So yes, you should always reach out to your doctor. At Deaconess, our behavioral health team are really good at helping us kind of deal with some of our daily stresses, you know, which leads to anxiety and more chronic types of problems. Chronic stress can lead to, as we know, fatigue, headaches, you know, trouble sleeping. We talked about irritability that leads to more organic diseases like high blood pressure, heart problems, cancer, diabetes, and some of these inflammatory-based diseases.
We definitely don't want heart problems. That's really bad when it gets to that point. We don't want it to get there. Also, it's Alcohol Awareness Month, and a lot of times people can turn to alcohol to manage stress.
Yeah.
Absolutely, yes. And we see that a lot, especially recently with the pandemic. You know, it's now, what, 5 years, but we're seeing the long-term effects of that stress. Alcohol is really a toxic chemical and a carcinogen, meaning it's a cancer-causing chemical. As we know, we think about the liver as the first organ, because the most common organ that gets affected, but actually a lot of other organs. The brain is actually very, very susceptible to alcohol. You know, you get the high from it, but you also get a lot of brain damage, leads to alcoholic dementia. The heart can get cardiomyopathy from the damage to the heart cells. Cancers, of course, besides liver cancer, you can get other cancer because it generates some cancer-causing chemicals. So, yeah, alcohol really is a carcinogen. So now, and some people say, well, what about some red wine? Red wine, because of the advantage of the pigment, that's the red pigment in it, does have some benefits, but you really have to talk to your doctor about what the recommended amounts are for healthy
levels.
And so really, the stress, so you maybe have a drink or two or three to relieve the stress, but then you become dependent on the alcohol.
Absolutely. So that's what we see, where a lot of the times we're using the alcohol really as a medication to kind of help us calm down, to help us sleep. I hear that a lot. I, you know, need a little bit of alcohol to kind of calm down before I can sleep. Those are all detrimental, and you need to talk to somebody. So again, at Deaconess, our behavioral health team is really great at helping us have access to healthcare resources. Of course, your first line of attack is your primary care doctor.
Right, but this is also a great resource, and you provide telehealth and in person. So
yes, absolutely.
All right.
Yes.
Well, Dr. Pearl, thank you so much for your time.
Thank you.